Hello friends, a very happy Republic Day to one and all. Today we'll be studying a very simple remedy which you are using in day-to-day practice. The remedy is gelsemium. I prescribed this gelsemium and I was able to study this remedy. Very simple case, and I was able to understand few of the delirium and delusion of gelsemium. So I would like to present this to you. I like to share what I learned from this case. So this gentleman, 58-year-old, he came to me with complaint of headache and pain abdomen. This headache was located here on the parietal region, and it was kind of feeling of heaviness over the head. The pain abdomen was not much, a kind of dull aching pain he was constantly having. So based on the symptoms which he gave, the heaviness of the head, especially on the parietal region, my first question to this patient was, why, what happened? He said that this pain was around 10 to 15 days back. It started around 10 to 15 days back. So I asked him direct question, what is the burden which you are carrying and why are you so angry about that burden or load which you are carrying? He said, yes sir, this is very true. When all the headache and this pain abdomen started, before that I was having so much stress, and even now also I am having so much stress. Actually, I am a loaning officer and I am in charge of whole of the loaning section. So the problem is that we are about to get audited, and I am very much tensed about this audit situation. So I asked him, what is the exact stress which you are having? He said, sir, this audit process is a very detailed process, and if there is any fault, then I'll have to bear it, and even I have to give the penalty, and even my promotions and perks will be denied. So I am very much tensed about it. Also, if I if there is some fault in my work, then there will be some correspondence with the head office. So it is not good for me also, for my career also. So he was very much tensed. Further, he said, sir, this auditing comes around 2 to 3 years, every 2 to 3 years. And every time this comes, I become very much tensed. There is so much anxiety, there is so much stress. Further, to add on, we do not have proper staffs. We lack in the staff. So we have to complete the work in time. Plus, there are routine customers to handle also. So this job has become very hectic, and I am overburdened with this task. So that is why the heaviness of the head. So try to understand this scenario, and on this history, based on this history, I formed few of the rubrics and I prescribed gelsemium. So first thing is, he said that I have to do things on time. So this audit is about to take place after 2 months. So for that I need to do preparation, and there is no time. So time is running away. So what he is feeling tensed. So this is ailment from anticipation, as simple as that. Then ailment from fright, anger, with. These are the two ailments which I was able to make out from this case. Then there is so much anxiety, there is so much fear in this patient. He fears that if there is any penalty, so he has to bear all the penalty, and if he fails in this particular task or the process of auditing, then his promotion and his perks will be denied. So this is fear business failure of. fear danger of impending, fear downward motion. What if I am not able to succeed? So this is fear downward motion of, fear injury of being injured. So these are the fears which we can make out from this particular case. So he was also anxious whether sorry, whether he'll be able to do all the formalities of audit in time or not. Also, there are less number of staffs here, so he had to work very hard. He's doing overtime and all the things he's doing. So this work of audit is like he's being tested. He feels that he's being tested. So for him, the audit is like an examination. So this is anticipation, examination before. This is the rubric for this. Then again, anxiety business about what will happen if I don't do the proper file work. What is going to happen in the future? So this is anxiety future about. And another anxiety is I need to complete the task on time. So this is anxiety, time is set as if. So this is the anxiety which he is having. So he, according to his perception, according to the perception of this patient, this task of audit is a very huge task. He is very much anxious whether he will be able to accomplish this huge task or not. So for this there is a rubric. Delusion, large, everything looks larger. So this stress or this task, for him it is a very large task. So according to his perception, this is a very big thing for him. Delusion, large, everything looks larger. You know, whenever gelsemium patient is in stress, so for him small things look very big. Small stress is perceived as a very big thing. Okay, so again he was puzzled. As soon as he got the news that audit is about to happen and you need to complete the task, and see there are no staffs available also, so he felt as if कि उसकी दुनिया घूम गई. As soon as he went into this stress, he felt कि everything is in a state of, he got puzzled. ये सब कुछ उसको उसके सामने घूमता हुआ नजर आया कि अब मैं क्या करूंगा. मेरे पास में ये काम भी है, I have this task also, I have that task also, routine customers, file work, old things he need to check. So he got puzzled कि उसको ऐसा लगा कि उसकी दुनिया घूम गई. So this is delusion, vertigo, having vertigo. So this process, it happens every 2 to 3 years. So for him in the past it was a very bad experience, might be, I did not ask, but the way he was saying about the audit thing is, being a 58-year employee, being a employee who is of 58 years of age, and still he is having that much anxiety. So it is quite obvious that he might have had a past bad experience about the audit. So this audit for him, it is like an examination. It is like a terrifying situation for him, a very stressful situation for him. And for this stressful situation, we have a word in repertory which is called as ordeal. So ailment from fright, ordeal of an. So this is ailment, fright from, ordeal of an. Fear, ordeals of. So for him, this is a very terrifying situation, and ordeal means a terrifying situation. So he's having that fear. So why is this? Why gelsemium is like this? Why is there so much anxiety? Primarily, he has so much anxiety because he lacks confidence in himself. There is lack of confidence, and because of this lack of confidence, he doesn't have, he feels that he does not have that capacity to do things properly. So there is one rubric: confusion of mind, self confidence, confidence want of, confidence want of, self confidence, self depreciation. So gelsemium devalues his own self. That is why the confidence becomes very low. Then this, because of this stress going on in the mind of gelsemium patient, he will keep on thinking and thinking and thinking about this stress, what to do, what to do. So because of this, he will not be able to sleep properly. Whenever there is stress, he'll end up in this cycle. So this is delirium, sleeplessness with, and gelsemium is there in this delirium. Then so he lacks confidence in his own self. So he feels that I will not be able to perform any task given to me because I am not capable of enough and I don't have the capacity. So I'll not be able to succeed. I will not succeed. So for this, there is a rubric: delusion succeed. He does everything wrong. He cannot. Okay, so this is the delusion. Delusion succeed. He does everything wrong. He cannot. Because of this lack of confidence in gelsemium, he feels that he is not able to, he will not be able to succeed. Success will not come to gelsemium, and that is why he rarely tries to take up the responsibility. He does not want to take up any duty or responsibility. So gelsemium is there in the rubric responsibility aversion 2. So I hope I was able to explain gelsemium, delusion, delirium, and a few of the fear rubrics and ailments of gelsemium. So friends, I hope I was able to give you some knowledge. I think I am able to share some views of mine. Thank you.